Working reception at a Norwegian private clinic when an American tourist stumbles in, bleeding from a cycling accident. Standard procedure: treat first, paperwork later. We patch up his road rash, give him antibiotics, send him on his way. Total time, 40 minutes. He stands at the checkout desk, credit card trembling in his hand, asking what his portion will be after insurance processes. I tell him the total, 320 kroner. About $30. He goes pale. Insists I'm quoting him the co-pay. I cover global healthcare from the inside, not headlines, not politics. If you want the real picture most Americans never get to see, subscribing keeps this level of clarity coming to you first. Demands to know the real bill because emergency room visits cost thousands. Refuses to believe this is the actual price. Starts asking if we're a discount clinic or if the doctor was fully licensed. Takes 20 minutes to convince him he's not being scammed. Finally pays, then immediately calls his wife to report he found a medical loophole in Norway and they should move here. Later that day, his insurance company called us. It's equally confused about why the bill was so low, asking if we'd made an error. We hadn't. My cousin works dental reception in Copenhagen. American exchange student comes in with a cracked tooth. After the procedure, she starts crying at the counter, hyperventilating about bankruptcy. The bill is 800 kroner, about $120. She thought we said 8,000. Keeps asking where the real bill is. Meanwhile, my brother's a pharmacist in Amsterdam. American asks for insulin. My brother quotes the price, 28 euros. American asks if that's per unit. No, per box. 3-month supply. American stands there calculating. Convinced we use different measurement systems for medication. Emergency medicine in Stockholm. American tourist has severe allergic reaction after eating something with hidden nuts. Ambulance brings him in, full anaphylaxis protocol, epinephrine, IV antihistamines, 6 hours observation, specialist consultation. He's stable by midnight. Next morning, he refuses to leave until someone explains the payment plan options. Keeps asking about his deductible, his out-of-network penalties. Whether the ambulance and hospital are in the same system, we tell him it's covered by the regional health authority. He asks what he owes. Nothing, we explain well. A small patient fee. He pulls out his phone's calculator, ready to input thousands. We say, 300 kroner, roughly $30? He accuses us of lying to avoid paperwork. This American embassy needs to know about our charity care system. Demands itemized billing, showing the actual costs before insurance. Takes 3 staff members to explain, this is the actual cost. Sweden negotiates bulk medication prices nationally. Nobody's insurance is involved because he's adjacent insured through reciprocal agreements. He starts crying, not from relief, from rage. Most people only ever see the symptoms of the American system. Here, we dig into the causes. If you're the kind of person who doesn't settle for surface-level outrage, this channel was built for you. Screaming about how this proves American healthcare is a deliberate scam and he's been robbed his whole life. Security has to calm him down. He leaves, then emails us weekly for 6 months, requesting documentation to prove to Congress what healthcare can cost. Physical therapist in Munich. American expat needs ongoing treatment after a sports injury. Weiss weekly sessions for 3 months. First session, he brings a folder of insurance forms 2 inches thick, preemptively arguing about coverage limits and lifetime maximums. I explain. German statutory insurance covers this. He asks about his portion. I tell him, 10 euros per session, capped at 20 sessions per year, then fully covered. He does the math, 200 euros maximum annual out-of-pocket for unlimited physical therapy after that. Accuses me of misunderstanding his policy. Insists on calling his insurance company on speakerphone right there. The insurance representative confirms everything I said. He sits in stunned silence, then demands to know what's the catch. Maybe we use unqualified therapists. Maybe it's group sessions. Maybe the equipment is outdated. I'm a licensed physiotherapist with a master's degree. Individual, hour-long sessions, modern facility. He starts Googling German physical therapy scams during his appointment. Eventually accepts this is real, then spirals into depression about the money he spent on similar treatment in America, stops coming to appointments because he's too angry to focus on healing, turns 3 weeks later apologizing, explaining he had to grieve his old medical bills before he could move forward. Pediatric nurse in Vienna. American family's daughter has persistent fever. They avoid bringing her in for 2 days because they're waiting to see if it gets serious enough to justify the cost. When they finally arrive, she's dangerously dehydrated. We admit her immediately for fluids. Full blood panel, pediatric specialist. Overnight observation. Parents are beside themselves, not about her condition, but about the financial devastation coming. Father keeps asking if they can negotiate down to just the essentials, or if they can pay in installments over 5 years. We stabilize their daughter. Next day, billing explains, their Austrian travel insurance covers it entirely, except a nominal facility fee, maybe 40 euros. Mother has a breakdown in the corridor, sobbing that in America this would have cost them $15,000 minimum. Starts questioning every medical decision they've made for their kids back home. How many times did they avoid necessary care because of cost? Father asks if they can retroactively get treatment. Records to see what they should have done differently, leaves asking if Vienna has good international schools, because they're never going back to that system. Pharmacy in Brussels. American comes in with a prescription for an asthma inhaler, standard albuterol. We fill it. He asks the price. 11 euros. He stares at the inhaler like it's a fake. Insists this must be a generic or expired batch because these cost $90 in America. I show him brand name, current production date, identical active ingredient. He starts researching on his phone right there in the pharmacy. It's pulling up American prices, calculating the percentage difference. Eventually determines he could fly to Brussels once a year, buy a year's supply of inhalers, and still save money compared to buying them at home, even with insurance. Asks if we ship internationally. We don't. Medication export laws. He starts crying in the pharmacy aisle. Not subtle tears, full sobbing. Other customers are concerned. He apologizes, explains he's been rationing his inhaler for 3 years, sometimes going without during low-risk situations to make it last. He's been living with partially managed asthma because of cost. Buys 6 inhalers on the spot or legal limit for short-term supply. Leaves, then returns an hour later asking if his cousin can use his passport to buy more. We have to decline. He understands, but says, people are dying because of pricing, and I can't even legally help them. Hospital administrator in Helsinki. American needs an MRI for persistent headaches. Routine scan? No contrast needed. We schedule her for next week. She asks about price quotes from multiple facilities so she can shop around. We explain, this is a public hospital. The price is standardized. She asks what it is. Maybe 200 euros out of pocket maximum, depending on her situation. She asks what the insurance negotiated rate will be. We don't negotiate, this is the cost. She literally doesn't understand the concept. Keeps asking what the pre-insurance price is versus the post-insurance price. There's no difference. We explain Finland regulates medical pricing. She asks if she should go private for faster service. Private might be next day instead of next week, but costs more, maybe 400 euros. She can't comprehend that more expensive healthcare is less than $500. Asks if Finnish MRI machines are older models or lower quality. I show her specs. Modern Siemens machine, same model used in major American hospitals. She gets the scan. Results are clear. Relief about her health lasts 5 minutes. Then she starts researching how much the identical scan costs in America, $3,000 average. Spends her remaining vacation calculating every medical procedure she's avoided due to cost and what it would have cost in Finland. Creates a spreadsheet. Emails it to her senators. Gets a form letter response about market-based solutions. General practitioner in Lisbon. American retiree moved to Portugal specifically for affordable healthcare. First appointment, he brings a list of 18 different specialists he sees in America and asks which ones he has to eliminate to keep costs manageable. I review his conditions: diabetes, high blood pressure, high cholesterol, arthritis, all manageable with a good GP and maybe 2 specialists. He insists he needs a cardiologist, endocrinologist, rheumatologist, ophthalmologist, podiatrist, and more. I explain. In Portugal, GPs handle most chronic condition management, referring to specialists only when necessary. He skeptically assumes this is rationing. I lay out his care plan. Monthly GP visits, quarterly specialist checks, regular blood work. His cost. Basic Portuguese healthcare contribution based on income. Probably 50 to 80 euros monthly for everything. Medications included through the national formulary at copay rates. He calculates, this is less than 1 month's insurance premium in America, never mind copays and deductibles. Doesn't believe it's sustainable. Asks, what happens when the system runs out of money or when he really gets sick? I show him. Portugal's system has existed for decades. When he really gets sick, he'll get treated. That's the point. He spends 6 months waiting for the catch, convinced something will collapse. It doesn't. Eventually accepts this is real, then becomes insufferable. Lecturing every American tourist he meets about how they're being robbed. Gets banned from 2 expat Facebook groups for healthcare ranting. Occupational health specialist in Berlin. American corporate executive here for a year-long assignment. Comes in for a routine work physical. During the examination, he mentions occasional chest pain he's been ignoring for 8 months. I immediately order an EKG stress test and cardiologist consultation. He panics, asks if we can wait until he's back in America where his real insurance can handle it. I explain this might be cardiac. We're not waiting. He tries to refuse, worried about costs, destroying his savings. I tell him, your German employer provided insurance covers this completely. Cardiologist sees him next day. Discovers partially blocked artery. Not emergency surgery, but needs intervention cardiac catheterization with stent placement. Scheduled for the following week. Total patient cost after insurance, maybe 200 euros in MISC fees. The procedure itself, the specialist, the hospital stay covered. He's stunned into silence. Surgery goes perfectly. Recovery is smooth. Before he leaves Germany, he comes back to my office just to talk. Tells me in America he'd been ignoring the chest pain because his deductible was $6,000 and he'd already spent $2,000 that year on his daughter's broken arm. He was gambling that the pain was nothing serious because he couldn't afford for it to be serious. Here, the cost never entered the equation. Just the medicine. He asks how Germans aren't constantly amazed by their system. I tell him, you only notice it when you've experienced the alternative. The thing about European healthcare isn't that its perfect wait times exist. Systems have flaws. Reforms are ongoing. But Americans arriving here don't see the flaws first. They see the absence of fear, the absence of medical bankruptcy. If this breakdown changed the way you look at health systems, imagine having this perspective before the next policy shock hits. Subscribe so you don't just react to the news. You understand it before it arrives. The presence of treatment as default. It's not luxury. Next time, Europeans try to understand American medical bills and assume they're reading them wrong. Spoiler, they're reading them correctly, and that's the horrifying part.